Hello, my name is Corey Todd and I'm a physical therapist assistant student from Jefferson State Community College, and today I'm going to be presenting to you the treatment of a 59-year-old female that has 4 days status post a right total knee arthroplasty. Total knee arthroplasty is a procedure in which damaged cartilage and bone are surgically removed from the knee and replaced with metal implants. The patient stated that she is a retired school teacher and that gardening is her main activity. She has a 2 to 3 year history of osteoarthritis symptoms that are greater in the right knee, and that her primary goals are to return to gardening and ascend and descend her stairs independently. Two subjective findings that I reassessed each treatment are the patient's pain level and the activities or movements the patient was doing to cause her pain. Two objective findings that were reassessed each treatment are the patient's active and passive range of motion for knee flexion and extension, and the circumference of her knee at the suprapatellar and infrapatellar borders. A soft tissue mobilization that I chose for my patient during the initial evaluation was longitudinal to the hamstrings. I performed this technique for 3 sets of 1 minute with a 30-second rest break in between. Okay, so the soft tissue mobilization that I chose is longitudinal to the hamstrings. So, on a scale from 0 to 10, 0 being no pain, 10 being the worst pain that you could ever imagine, what would you give your pain today?
5.
Okay, alright, so this shouldn't hurt. You shouldn't feel any pain. You should be pretty comfortable. So if you feel any pain, just let me know and I'll reduce the pressure that I'm putting back here on your leg, okay?
Okay.
Alright, so what this is going to do is it's going to help the muscles back here in your leg relax. It's going to increase their flexibility, and it's going to help minimize any pain that you may be feeling back here in your leg. Does that sound okay to you?
Sounds great.
Alright, do you have any questions?
No, sir.
Alrighty, so we're going to go ahead. We're going to get some lotion back here on your leg. Alright, and then we're just going to go long ways along the fibers of your muscle. We're going to do this for 3 sets and for 1 minute on each set. We'll take a 30-second rest break in between. An objective finding related to choosing longitudinal soft tissue mobilization to the hamstrings is that right knee active range of motion and passive range of motion are limited by pain. A home exercise that I chose for my patient following the initial evaluation is hamstring sets. I chose this exercise for strengthening of the hamstrings and to give the patient better control of the knee during ambulation. Okay, so next I'm going to teach you an exercise that you can do at home. So what you're going to do is you're going to lie down on your back like you're doing now with your arms by your side, your legs out straight just like so. And I'm going to place a towel roll under each of your knees. So you will need towels at home when you're doing this. So I'll lift your leg up, place one under here. Actually, I might get away with just one. Okay. Alright, and what we're going to do is with the back of your heel, you're going to press your heels down into the surface below you and back towards your bottom. So you're going to press your heels down, back towards your bottom. You're going to hold there for 5 seconds. So 1, 2, 3, 4, and 5, and then relax. Okay? And so when you're at home, you can do this on a table, on your bed, on a sofa, just any flat surface, on the floor, just whichever you prefer, whichever is more comfortable to you, and making sure to put the towel roll up underneath your knees. Okay, and while you're doing this, remember as you're bringing your heels down to the surface, you want to breathe in, and then as you relax, that's when you breathe out, okay? When you're at home, perform this exercise for 3 sets of 10 repetitions. So you'll bring your heels into the surface below you, hold for 5 seconds and relax. That'll be 1. Okay, so you'll do that 10 times for 3 sets. Make sure to take 35, 40-second rest break between each set. And we'll do this 3 times daily. While you're performing this exercise, if you feel any light pain, just decrease the pressure that you're putting into the table or whatever surface is below you a little bit and see if that deals with the pain. If you feel sharp pain, make sure you stop the exercise and tell your physical therapist immediately. Don't do any more exercise until you notify him. And when you're performing this exercise, hamstring sets should be felt in the back of your leg here, right below your bottom. Okay, were you feeling that there while you were performing it?
Yes.
Alrighty. An objective finding related to choosing this home exercise is that with a cane, the patient ambulates 15 feet with moderate assistance and demonstrates decreased stride length and decreased stance time for the right lower extremity. One patient education activity that I addressed with my patient during the initial evaluation is for the patient to avoid long periods of knee extension on the right side. By doing this, the patient can avoid developing knee extension contractures, which would decrease knee range of motion. To avoid staying in a position of knee extension for too long, I educated her on placing a pillow underneath her knees to position her knee into flexion. With the patient already having limited active range of motion, educating her to place a pillow under her knees will prevent deterioration of progress and help her to accomplish her goals. The prognosis for my patient is good. By sticking to the treatment plan, the patient should have no problem returning to her previous level of function. I feel that when the patient returns to gardening, she will need a bench or a small stool to sit on to avoid unnecessary pressure on her knees. The reevaluation shows improvement in the patient's active and passive range of motion of her knee. She has become more independent with ambulation and is doing well with ascending stairs. The reeval calls for 2 more weeks of physical therapy, and I feel that if the patient works hard towards her goals, then she should be back to normal function within that time frame. After the 2-week addition to her therapy, the patient should be ready for outpatient rehab to further her strengthening of her lower extremities.